about the symptoms and the causes of people with autism spectrum disorder. We can see three behaviors from people with autism spectrum disorder that differ with other normal people. The first symptom is most of them are having problem in their social skills. A person with autism tend to feel terrible to be in crowd and socialize with others because they're hard to share their attention and focus on the same object or event. There is also probability for them to get avoided by people because they hardly can understand others people feeling and rarely detected in any conversation. Furthermore, some of people with autism may have challenges in understanding, talking, reading and writing. Understanding words or using gestures like pointing, waving or even following the direction could be troublesome to them. Instead of behavior, people with autism have the tendency to exhibit the unpredictable behavior. They can cry, laugh or become angry for unknown reason whenever they feel want to do it. This also happens because they use these challenging behaviors instead of words to communicate of what they want. Now, how about the causes of autism spectrum disorder and how people can get this? Okay, autism spectrum disorder probably caused by the genetic differences. However, there is no exact causes for autism. Even there is very strong heritable component in autism in few studies, but still the exact mode of genetic transmission is not yet understood. There is also a research that trying to figure out the variation between portion of the genetic risk inherited with the de novo genetic mutation. Jocelyn 2014 state that it seems that much of the risk for autism is indeed inherited from one's parent. Nevertheless, de novo mutation also increase the significant portion of risk. In conclusion, that is so important for us to know about factors that increase the likelihood of genetic mutations. Even the findings result cannot explain about the causes of autism, but we still can decrease their occurrence using this all information to practice in our family planning.
I'm going to discuss about treatment for autism spectrum disorder. Actually, there is no cure exists for autism spectrum disorder, and there is no one fit size all treatment. The goal of the treatment is to maximize your child's ability to function by reducing autism spectrum disorder symptoms and also supporting development and learning. Early intervention during the preschool years can help your child learn critical social, communication, functional and also behavioral skills. The range of home-based and also school-based treatment and intervention for autism spectrum disorder can be overwhelming, and your child needs may change over time. Your healthcare provider can recommend an option and help identify resources in your area. If your child is diagnosed with autism spectrum disorder, talk to experts about creating a treatment strategy and build a team of professionals to meet your child's needs. Treatment options may include behavior and communication therapies. Many programs address the range of social, language, and behavioral difficulties associated with autism spectrum disorder. Some programs focus on reducing problem behavior and teaching new skills. Other programs may focus on teaching children how to act in social situations or communication better with others. The next one is educational therapy. Children with autism spectrum disorder often respond well to highly structured educational programs. Successful programs typically include a team of specialists and a variety of activities to improve social skill, communication, and behavior. Preschool children who receive intensive, individualized behavior intervention often show good process.
Next is family therapies. Parents and other family members can learn how to play and interact with their children in ways that promote social interaction skills, manage problem behaviors, and teach daily living skills and communication. Other therapies is depending on your child's need: speech therapy to improve communication skills, occupational therapy to teach activities of daily living, and physical therapy to improve movement and balance may be beneficial. A psychologist can recommend ways to address problem behavior. Next is medication. No medication can improve the core signs of autism spectrum disorder, but specific medications can help control symptoms. For example, certain medication may be prescribed if your child is hyperactive. Antipsychotic drugs are sometimes used to treat severe behavioral problems, and antidepressants may be prescribed for anxiety. Keep all healthcare providers updated on any medication or supplements your child is taking. Some medication and supplement can interact, causing dangerous side effects.
Okay, for me, autism spectrum disorder is about developmental disability that's significant of social knowledge and behavioral things that make the person or the group of a person can join the social communities. Yeah, I agree with that statement because it obviously we can see that nowadays autism spectrum person is hardly to join the communities because they have lack of communication. Because sometimes when we communicate, they hard to understand what we want to give or what we want to deliver to them. So that's why they are separate from the communities. I think in my opinion, awareness of this issue, autism, is still lack in our community. This is because we can see that the person that have a kids that autism, they still can handle or control the kids, and somehow there is still a person that doesn't even know that this is still exists.
As we make inference from the given statistic, in a few short years, the kids will be looking for autism intervention program, and that is likely to increase every year by the same number. This has led to a growing demand for early intervention centers and specialist preschool.